Why are the pregnancy rates with day 5 transfers better than with day 3 transfers? This is actually very intuitive and very simple. We all know that you have an egg, you have a sperm, it fertilizes, it makes an embryo. Then this embryo keeps on dividing. It goes from day 2, which has 4 cells, day 3, about 8 cells, until it forms a blastocyst with over 100 cells on day 5 or day 6, which is when you put it back in the uterus. The reason we want to keep the embryos in the incubator for as long as possible is it allows us to pick the best embryos. So you're not playing any, mini, minor, more. You're allowing the embryos to compete amongst themselves. And the reality is not all day 3 embryos are going to become day 5. This is why the success rate is better. More importantly, it also allows you to transfer only one embryo at a time. Because when you're doing day 3 transfers and you don't know which one's going to implant, you tend to put too many of them back inside. And a lot of these patients end up with high order multiple pregnancies like triplets and quadruplets, which is a complete iatrogenic medical complication and carries too many risks. Whereas when you're doing a blastocyst transfer, you can happily put back only one embryo, knowing that you've given the patient the best chance of achieving a pregnancy. And this is why it's so important that patients be proactive and do their homework and understand the difference between a day 3 embryo and a day 5 embryo. And the tragedy is a lot of patients don't. And a lot of doctors hide this basic information from patients, which really bothers me. Some doctors will actually claim that the success rates with day 3 embryos are as good as with day 5 embryos. That's pure rubbish. That's not even true inside the human body because a day 3 embryo belongs in the fallopian tube, not in the uterus. It's only a day 5 embryo which actually reaches the uterus. So putting an embryo before day 5 into the uterus actually reduces implantation rates. And you should push back if your doctor forces you to do this.